So my last client is a 3 on the Fitzpatrick scale, but sometimes I have to treat her like a 4 because she's always out in the sun in the summer. Even though the tan can look settled in, a lot of times it's like you have to look at the skin and judge. And so in the wintertime, her legs are way lighter than this. So I treat her underarms, bikini line, and full legs. Her underarms I treat as a 3 because they're so light. But then her legs, I'm like, wow, like, no, they're totally a 4. But the good thing about the Splendor X, flip the camera real quick. I always say that the tan is present on her, and then she is a 3. So, thick hair. So this is what it gives me. She would only have 3 jewels on the Alex and 12 on the YAG. But the difference is the pulse duration. It's gonna take longer for that area to heat up instead of the 3 milliseconds that I would want. So those settings are the safe settings for this Fitzpatrick 3 client, which looks like a 4 on the legs. If I were to say that she's a 4, right? No tan, an automatic 4, thick. I'm gonna get a 5 of the Alex and 7 on the YAG. Clearly they're really safe settings because look at what it's giving me for a normal 4, right? So, but if you notice the pulse duration is 3, so it'll heat up that hair in that 3 milliseconds. So that's the difference between treating tan skin and skin that's automatically a 4. It's hard not to be in the sun in Florida, but you have to be safe. If it looks fresh, I will reschedule. Like fresh, I'll reschedule. So depending on how it looks, then I may treat them as, okay, they have tan skin, right? But it has to at least be settled in for some time before I treat the client as tan skin. And I would say that's possibly the hardest part, of doing laser hair removal. It's looking at the skin and judging, the situation and keeping in mind everything, what their ethnicity is, if they've gotten a recent tan or not. Have you been on any new medications since your last treatment? And have you taken any medications today, like any over-the-counter medications? Because those can affect the treatment or they can affect what you feel. So you're constantly trying to figure out all these things, and then that can determine on what settings you're going to use. So when in doubt, especially with 3s and 4s, when you have a client who is between a 3 and 4, right? They could be 3 when it comes to like heritage, but their skin tone looks more like a 4. You always want to just treat them like a 4. Like if you have a machine where you can only choose the Alex or only choose the YAG, then just choose the YAG. But at least with the Splendor X, what I can do is I can still use the Alex, right? But then I'll just lower the Alex a little bit and raise the YAG more. But I love the fact that I can still give them both wavelengths and still be safe at the same time.